Hello dear students. Today we are going to discuss about the part that is antibiotic. Here lecture number 2. In this lecture we are going to cover nomenclature pattern of the antibiotic, that is penicillin, its stereochemistry, structure activity relationship of the structure of the penicillin, and the chemical degradation which is happening in our body with respect to the penicillin, and classification of the antibiotic. Now in yesterday's class we have already started a discussion on the classification of the antibiotics. The antibiotics are, so we will proceed accordingly. Antibiotics are classified into basically 4 categories depending upon the spectrum of activity shown by the antibiotics, which we have already discussed in yesterday's class. Then the second type of classification is based on the source of origin. So the first type of classification, that is based upon the spectrum of activity, that means whether the antibiotic is selectively towards only one category of the microorganisms or bacteria. Depending upon that, those antibiotics are categorized as narrow spectrum antibiotics, and those antibiotics which will show the activity towards gram positive as well as gram negative microorganism, that means they are going to show the broad spectrum as an antibacterial action. Those are categorized under the category broad spectrum antibiotics. So these are the 2 categories under which the antibiotics are classified. In the category number 1, that is based upon the spectrum of activity. So today we are moving towards the second type of classification of the antibiotics, which is totally based on the source of origin. From which source we are going to obtain that particular antibiotic. So we will proceed accordingly. Second classification is from the source of origin, whether we are obtaining that antibiotic from the natural source, whether we are deriving the same antibiotic or those antibiotics examples from the semi-synthetic antibiotics, and the next one is synthetic antibiotic. So we will proceed accordingly. Our first class is natural antibiotic. They are totally obtained from the fermentation procedure of the microorganism. So the examples of those such antibiotics is bacitracin and polymyxin. So these are the examples of the compound which are obtained simply the natural fermentation mechanism, that is the natural source. Next is semi-synthetic antibiotic. They are produced commercially by adding a chemical agent to the final product. So whatever the compound is there in which we are going to do 1 or 2 chemical reactions, so they may change their structure. Available product in which we are going to do some sort of modification through addition of any chemical agent is known as semi-synthetic procedure or semi-synthetic source of antibiotic. And examples of such antibiotic is penicillin G and penicillin V. Please take a note of the same. What type of antibiotics we will obtain from the semi-synthetic source? Penicillin G and penicillin V. Next, the further category or the further class of the antibiotic, that is from the source of origin, that is synthetic antibiotic. Antibiotic which have purely or they are purely synthesized origin are chloramphenicol is the source or the example of the compound which is obtained through a synthetic mechanism. Next type of classification is based upon the mechanism of action. Now we all know, we have discussed in detail what is the definition of antibiotic. Antibiotics are the category of compound synthesized by the living organisms in order to inhibit or kill the microorganisms, but they are of different species, and very important highlighted word is in how much concentration? in very low concentration, they are going to inhibit or kill those microorganisms. So this is the definition. That means those antibiotics are going to kill or either they may inhibit the growth. If they are killing the microorganisms, they are coming under the category that is bactericidal action. In a study class, we have already discussed that. What is the difference between bacteriostatic and bactericidal? What is bactericidal? If any agent is going to kill the bacteria, we are categorizing them under bactericidal category, and if any agent is going to stop the growth of the microorganism, we are categorizing them under bacteriostatic action. Now, so a series of antibiotics going to show inhibition and bacteriostatic action through various or different type of mechanism of action. So through which mechanism they are inhibiting or killing the bacteria, they are basically categorized under 4 categories. Category number 1 is drug which will interfere with the bacterial cell wall synthesis. Now we all know those bacteria have their rigid cell wall which is protecting themselves, or whatever the cell organelles are there of that bacteria, those all are protected by the rigid cell wall. But there are category of the antibiotics compound which will stop the growth of the bacteria. Those are cephalosporin, penicillin, viomycin and cyclosporins. These are the 4 examples of the antibiotic class. They are of different categories, they are of different types, they are of different species, but through which mechanism they are acting as a bacteriostatic or bactericidal? By interfering with the biosynthesis or the formation of the bacterial cell wall. Second class is drug which will interfere with the functioning of the cytoplasmic membrane. Now we all know cytoplasm of any cell have its own importance, passing of nutrient medium and all, but there are category of antibiotics which will interfere, which will destroy the functioning of the cytoplasmic membrane of that bacterial cell wall. And if they are interfering with this mechanism and showing bactericidal or bacteriostatic action, they are categorized under the category drug which will interfere with the functioning of the cytoplasmic membrane. They are nystatin, amphotericin and polymyxin B. Next is drug that interfere with the protein synthesis. Now we all know protein are synthesized as an energy storage compounds of those bacteria, and some of the category of antibiotics which will stop or inhibit the procedure of protein synthesis. Those are chloramphenicol, erythromycin, aminoglycoside type of antibiotics and tetracycline. Now we have already discussed that majority of these classes are acting as a broad spectrum antibiotics because they are interfering with the protein synthesis of that bacteria. Next is drug which will interfere with the nucleic acid biosynthesis. Now we all know nucleic acid is a very important cell organelle of every cell which is involved in the cell replication, duplication of the cell, passing of the genetic message from one cell to the another cell. Now we all know the importance of nucleic acid in every cell. There are drugs molecules which will interfere with the procedure or the functioning of the nucleic acid biosynthesis, so that cell unable to complete its mechanism. Those are actinomycin, griseofulvin, rifamycin and mitomycin. So this is a second class of the, this is the third class of the classification of the antibiotics, which is totally depending upon the what type of mechanism of action they are following to show their bactericidal and bacteriostatic mechanism. Now this is a diagrammatic representation how they will acting as a antibiotic, whether by inhibiting or interfering the procedure of cell wall synthesis, interfering in the functioning of the cytoplasmic membrane, interfering in the synthesis of protein synthesis, and interfering in the formation of the nucleic acid. So this is diagrammatic representation and the classes of the compound. So this is a cell membrane of the body, and this is the rigid cell wall of the bacterial cell wall. Now we will moving from this way. The first category of the compound, which will inhibitors of the metabolism. Now we all know bacteria, by using a chemical agent, that is para-amino-benzoic acid, they will synthesize their required product, that is tetrahydrofolic acid. Now due to which they are going to survive themselves. But there are some antibacterial compound which will inhibit this procedure of conversion of para-amino-benzoic acid into the tetrahydrofolic acid, and those are the category of compound that are sulfonamides and trimethoprim. We have discussed this sulfonamide compound in the lecture number 1, that is during the history of synthesis or the derivation of the antibiotics. They have synthesized the sulfonamide compound as an antibacterial agent. How this sulfonamide compound is going to be act as an antibacterial? By inhibiting the conversion of PABA into the THFA. Now next class of compound, inhibitor of cell wall synthesis. This is the first class of classification of the compound depending upon the mechanism of action. Already we have discussed that they will stop the formation of this cell wall. They will interfere in the formation of the cell wall. So the cell wall is not formed properly. So the cell will die or cell will stop the growth of the bacteria. And the categories of the compound are beta-lactam antibiotic and vancomycin. Third category of compound is inhibition of the protein synthesis. Now we all know the nucleic acid material containing DNA, during its replication procedure, they will unwind its strand and release mRNA for the formation of the protein. This messenger RNA will carry the message which protein is to be synthesized. This particular step is known as transcription and a translation. Now, due to this stopping or inhibiting the mechanism, the mRNA unable to synthesize a required protein, because those antibiotics will interfere in this procedure of formation of protein synthesis. And what are the categories of the compound which will stop this protein synthesis mechanism? Tetracycline, aminoglycoside, macrolide antibiotics, clindamycin and chloramphenicol. So this is a categories of the compound inhibiting protein synthesis. Next is inhibitor of nucleic acid function synthesis. Now we all know formation of mRNA, which is propagating and forwarding towards protein synthesis. If we inhibit the unwinding of the DNA, who is carrying the message, that is which protein is to be synthesized, if we stop this procedure, that is unwinding, we can ultimately stop the growth as well as inhibit the we can kill that bacteria. And the examples of those class of compound are fluoroquinolones and rifamycin. This is a diagrammatic representation of the classification of the compound, that is antibiotic, on the basis of spectrum of activity. We have already discussed that categories of the compound showing action towards, some are going to show their action towards only gram-negative bacteria, that is polymyxin. We have categorized this polymyxin under narrow spectrum because This compound is only selective towards only one class of compound, one category of the compound, that is gram-negative bacteria. But there are classes of compound which will show their broad spectrum towards both gram-negative as well as gram-positive as well as chlamydiasis and rickettsias. So those are penicillin, one class of compound which will show action towards gram-negative, gram-positive as well as other sorts of the bacterial infections. So this is depending upon the spectrum of activity. Last and final and very important class of the antibiotic class is based upon the chemical structure. What type of chemical structure they have in the from the chemistry and stereochemistry point of view. So the first class is beta-lactam antibiotic. If they possess beta-lactam ring in their structure, that is drug that contain beta-lactam ring in its structure. And examples of the such classes are penicillin, cephalosporin, monobactam and beta-lactamase inhibitors. So these are the categories of the compound which will contain beta-lactam ring in its structure. Next is aminoglycoside antibiotics. Then now the name itself giving an idea about the what type of chemical composition they possess. They possess presence of amino group, they presence of glycoside. Glycoside means glucose molecule or sugar moieties is present over there. Now the classes drug that contain sugar moieties which is attached to the amino group are categorized under the compound or the class aminoglycoside antibiotics. And examples of such antibiotics are streptomycin, gentamicin, neomycin and kanamycin. Next class is tetracyclines. Drug that contain 4 cyclic compounds. If the name itself suggests here also that tetra means 4 and cyclic structure. If any drug molecule or any chemical compound containing 4 cyclic rings and going to show antibiotics action, they are categorized under the category tetracycline. Those are chlorotetracycline, oxytetracycline and doxycycline. Next class, peptide antibiotics. So peptide means presence of peptide bond. What is peptide bond? When the amino acid or the 2 or more amino acid join to each other, they will join through a peptide linkage. So those antibiotics are categorized under peptide type of antibiotics. Drug that containing amino acid groups are categorized under peptide type of antibiotics. Those are bacitracin and amphotericin. Next, a newer class is macrolide type of antibiotic. So what is the meaning of the word macrolide? Drug containing macrocyclic ring. Big ring structures are there and there is a presence of lactone ring. So the drug containing macrocyclic ring with the lactone group, they are categorized under the category macrolide. And examples of the classes are erythromycin, azithromycin. Next is leishmaniasis, drug that contain more than 16 atoms. Licomycins and clindamycin. Next is antifungal antibiotics, drug used to treat fungal infections. If any category of the drug which we are using to treat a fungal type of infections, those antibiotics are antifungal antibiotics. And the last class is miscellaneous, in which chloramphenicol is an example, which is having a totally different structure and coming under the category of broad spectrum antibiotic. Now we are moving towards a first series of antibiotic, that is penicillin. While we are discussing in lecture number 1, that is penicillin is discovered by Alexander Fleming when he is doing a study on the microbial species, but there is some accidental growth of the fungal, that is of Penicillium notatum, and which stopped the growth of other bacterial cell. So he has given the name, that is that antibiotic is penicillin. This we have already discussed in lecture number 1. Now penicillin is a secondary metabolite which is produced by the bacteria. Penicillin have the presence of beta-lactam ring in its structure. Now we will see what is the meaning of the word this beta-lactam. Beta-lactam is one of the structural structure which we will show in the next slide. A bacterial infection is caused by millions of tiny bacteria that are trying to survive by multiplying in the host cell. Now what are bacteria? Bacteria will survive by using a nutrient material of the host cell. But these type of antibiotics like penicillin will attack and kill those bacteria which are surviving on the host cell. Penicillin is used as an antibiotic. It was obtained from the source Penicillium notatum, and they are nowadays are extracted from the Penicillium chrysogenum. So there are two species of the compound we are synthesizing. Penicillin, those are Penicillium notatum and Penicillium chrysogenum. Before the development of penicillin, many people suffer and die due to the bacterial infection. No doubt, in 1928, Alexander accidentally discovered this antibiotic, but before this, there are many people die due to the bacterial infections. So penicillin G is the first antibiotic which is introduced into the chemotherapy. Now what are the uses of this penicillin compound? We can use penicillin for variety of skin infections, dental infections, ear infections, respiratory tract infections, UTI type of infections, and gonorrhea. Now we are moving towards the nomenclature pattern of the penicillin. Now we already discussed that penicillin have the presence of beta-lactam ring in its structure. So the another name given to those category of antibiotic is beta-lactam antibiotic. So the basic structure of penicillin is, this structure is known as beta-lactam ring. Now we will discuss in detail. So this is a numbering pattern of this beta-lactam structure, in which the sulfur atom is assigning the number 1, and likewise the assignment of the number given accordingly. This structure possesses a presence of thiazolidine ring having a carboxylic acid functional group which is attached to the beta-lactam ring. That means thiazolidine ring attached to the beta-lactam ring is a very important parent structure of the penicillin, followed by acyl amino side chain. This acyl amino side chain are maybe aliphatic group or it may be a aryl group. Depending upon that, if we substitute this R with either aliphatic or with the aromatic group, they will give the variety of actions depending upon the structure activity relationship. Now according to the chemical naming nomenclature system, sulfur has assigned the number 1 and nitrogen we are going to assign the number 4. So name of this penicillin structure is 6-acyl group, 6-acyl amino, this is 6th acyl amino, 2,2-dimethyl, 3-carboxylic acid, and this particular ring is known as Penam ring. Now penicillin structure contain 3 chiral carbon atoms. Now what is the meaning of the word chiral carbons? Chiral carbons are those carbons which are attached to the 4 different functional group and show a optical rotation. कुणाला म्हणतो आपण chiral carbon atom? कायरल कार्बन ॲटम्स असे कार्बन ॲटम असतात की जे वेगवेगळ्या चारी बाजूनी वेगवेगळ्या फंक्शनल ग्रुपला अटॅच केलेले असतात आणि ते डिफरंट टाईप ऑफ स्टेरिओकेमिस्ट्री शो करतात. अशा त्या प्रेझन्स ऑफ कायरल कार्बन ॲटममुळे ते वेगवेगळ्या प्रकारची स्टेरिओकेमिस्ट्रिक प्रॉपर्टी शो करतात. म्हणून त्या कंपाऊंड्सना किंवा त्या कार्बन ॲटमना कसले कार्बन ॲटम म्हणतो आपण? दीज आर नोन ॲज chiral carbon atoms. Now this particular structure have the presence of chiral carbon atoms at carbon number 3, carbon number 5 and carbon number 6. So if anybody asks, in the given structure how many chiral carbon atoms are there? There are totally 3 chiral carbon atoms are there, and depending upon the calculation of the chiral carbon atom, variety of optical rotation and stable and unstable type of configurations are shown by the penicillin compound. So total 3 chiral carbon atoms are present in a given structure of the penicillin, in which the carbon number 6 is going to show L configuration, carbon number 3 and carbon number 6 are going to facing to opposite to the each other. Carbon 3 and carbon 6 are facing opposite to the each other. All synthetic and semi-synthetic penicillin have absolute configuration. They are, third carbon atom is going to show S configuration, fifth carbon atom is going to show again S configuration, and sixth compound carbon atom is going to show R configuration. Now we are moving towards very important pharmacochemistry point of view of the discussion of the penicillin. That is, what is the meaning of the word SAR? SAR belongs to structure activity relationship of the penicillin. If we change the structure, if there is replacement of any compound with either bioisosteric type of replacement, they are change their activity, either activity is increased or the activity is decreased. So we have discussed this, the structure activity relationship of the penicillin. At first position, if the position number 1, that is sulfur, is oxidized to, if we are going to do the oxidation, or if the penicillin is undergone oxidation procedure at carbon number 1, this sulfur atom is converted into sulfone or sulfoxide, and this obtained sulfone or some sulfoxide compounds decrease the activity of the compound. Now next is methyl group are necessary for the position 2. This presence of dimethyl group is required at position number 2. Next, replacement of methyl group decreases the activity. Third carbon atom, there is presence of carboxylic acid functional group, of which ring? Thiazolidine ring. And this particular type of carboxylic acid group is required for antibacterial activity. Replacement of carboxylic, if we are going to replace this carboxylic acid group with either ether or alcohol, these are the oxidized product of the carboxylic acid functional group, and if we can replace the ethyl or alcohol group over here, it will decrease the activity. Next is beta-lactam ring is required for the antibiotic activity. This beta-lactam ring, presence of beta-lactam ring is also essential for the antibiotic activity. Nitrogen atom is must for the presence of penicillin. Presence of nitrogen atom is must for the penicillin. No substitution is allowed at fifth position. Fifth position is every time it is unsubstituted, which will show a good sort of action. So no further substitutions are allowed at fifth position. Amide side chain with R group, that is R group, is essential for the antibiotic activity. Now there are some of the examples of the penicillin. We will be discussing examples with their use. So the first example is benzyl penicillin. Benzyl penicillin structure is, this is the thiazolidine ring, this is beta-lactam ring, This is our acyl side chain, and the R group is attached to the benzyl ring. So this is the structure of benzyl penicillin. Next is, this compound is going to show now a spectrum of antibiotic used to treat various bacterial infections which are caused by streptococci, meningococci, gram-positive bacilli, and spirochete type of infections. The strain of staphylococcus and Neisseria gonorrhea species shows resistant towards the release of lactolactame enzyme. Next example is phenoxymethyl penicillin, which is nominated as penicillin V. Now in earlier class there is a substitution of the benzyl ring is at R position, so the name of the compound is benzyl penicillin. Here we have substituted phenoxymethyl group substitution towards the penicillin structure, so the name of the compound is phenoxymethyl penicillin. This is effective for the treatment of laryngitis, bronchitis, pneumonia, soft tissue, skin infections which are caused by the susceptible bacteria. To treat a reoccurrence of rheumatic fever, so we can stop the reoccurrence of the rheumatic fever by giving a treatment of phenoxymethyl penicillin, and it is effective to treat oral cavity infection. Next example is amoxicillin. So this is the structure of amoxicillin, thiazolidine ring with a beta lactam ring with the acyl side chain. This is our amino functional group which is attached to the aromatic ring structure, which are used to treat sinusitis and other upper respiratory tract infections, which are used to treat urinary tract infections, prophylaxis treatment of the heart and bacterial endocarditis. Amoxicillin is effective to treat bacterial infection of ear, nose, throat and tonsillitis. Next example is cloxacycline. So this is thiazolidine ring, beta lactam ring, amyl side chain and a presence of aromatic moiety. This is active against gram-negative bacterial infections as well. These are used to treat bacterial infections of bone, heart, lung, skin and blood. They treat staphylococcal infections which are resistant to benzyl penicillin, cloxacillin and is less than the penicillin G. Next example is ampicillin. Ampicillin is used for the therapy of meningitis along with third generation cephalosporin. That means this particular drug is given in combination with the another theory of the compound, that is cephalosporin. Ampicillin plus gentamicin can be given to treat pneumonia and gram-negative infection. To treat the hepatic encephalopathy and as well as to treat the biliary tract infections. Now we all know, no doubt these examples of the penicillins are used to treat variety of infections, but one of the limitation of penicillin is they are going to have some side effects. Those are allergy, hypersensitivity reaction. Penicillin compound is going to have hypersensitive type of reaction depending upon variety of the patient. They will have the bleeding in the gum, degenerative changes in the spinal cord, convulsion, rashes, itching, urticaria and fever. The patient is going to show wheezing, that is making a sound while breathing, angioneurotic edema, swelling of the facial area, serum cyanosis. So these are or anaphylactic shock or anaphylaxis. These are in rare situation. So these are real side effects of the penicillin. Now how this penicillin is going to show its mechanism of action? It will interfere with the synthesis of bacterial cell wall, because cell wall are composed of peptidoglycan layer which consists of two amino groups. So peptidoglycan layer is going to have a presence of two amino sugars, that is N-acetyl muramic acid and N-acetyl glucosamine. So peptidoglycan residue are linked together forming long strand and UDP. Next, then the cleavage of the terminal D-alanine and of the peptide occur by transpeptidase enzyme. This process is called as transpeptidation. This cross bridging of the bridging provides the necessary strength to the bacterial cell wall, because if the cell wall is rigid, it will show the strength towards that bacterial cell wall. So this is a diagrammatic representation. This is a cross bridging of the transpeptidase enzyme, which will proceed for the formation of the bacterial cell wall. If we stop the procedure of formation of bacterial cell wall, the cell wall is unable to form, and the bacteria cell will die. Next, one and very important limitation with the penicillin class is they are unstable towards acidic media as well as basic media. So the penicillin compound is going to be unstable in acidic and basic environment. So it will form, when it is coming in contact with either acidic or either basic medium, they will form different category of the compound, that is penicillinic acid, and one is penicillinic acid. Likewise, now this are further metabolized to penylic acid, penylinic acid. So these are the examples of the chemical degradation of the base. Now degradation of the penicillin takes place, already we have discussed, in alkaline as well as acidic condition in the presence of enzyme beta lactamase enzyme. Some are going to inhibit the nucleic acid synthesis, and some presence of nucleophiles like water and metal ion. Chemical degradation of the penicillin are penicillinic acid, penicillinic acid, pinamandelic acid, phthalic acid, penicillinic acid. Next are penicillinic acid, penicillinic, pinamandelic acid, penoic acid, penicillinic acid, and phenolic acid. So thank you. So today we have discussed that the penicillin classification, from source of origin, from the mechanism of action, from the spectrum, uses of the penicillin, nomenclature, stereochemistry, SAR of the penicillin, some of the examples of the penicillin, structure, activity, side effects and toxicity of the penicillin, and mechanism of action. So thank you all of you. We will discuss in next class the next type of antibiotic, that is cephalosporin. Thank you all.